Hi, my name is Dr. Cary Ganz, and I'm the president of the Long Island Group for Headache Management, located here in Garden City, New York. I wanted to talk to you a little bit today about those of you that are suffering from chronic headaches. Now, that includes such headaches as migraines, tension headaches, cluster headaches, and just about any type of head and neck pain that you've been suffering with for weeks, days, months, years, whatever. There are a lot of people out there, supposedly 45 million Americans, that suffer from chronic headaches. That could be one headache a day, could be 25 a month. This is a problem that many people are suffering from, and up until now, the treatment for this was really not terrific. Very often patients had to go ahead and have surgery. There were a lot of surgical procedures, not all of them successful. A lot of medication. People put on all kinds of muscle relaxants, pain medications, things of that, neurological medications, things of that nature. Very often dental splints were used because a lot of this relates to the head and neck muscles. So dental splints were used, but oftentimes these required long-term wear, inconvenient, and often just didn't have long-term results. The problem with a lot of this, as far as we see here at the Long Island Group, was that, first of all, there wasn't a lot of diagnostic data used. And in the past, many times, head and neck pain was treated symptomatically. Patients came in with head and neck pain, chronic pain, maybe TMJ in their joints, and they were given medication to relieve the pain, sometimes, as I said, muscle relaxants, etc., or put into a splint. This was based upon the symptoms only, and very often patients would come in with no symptoms and put on splints because there was wear and tear of teeth, breakage of teeth, clenching and bruxing, things of that nature. Once again, without any real diagnostic or scientific data to support this. Well, that's all changed. It's changed in two facets, by the way. The first is diagnostically. Well, today, thanks to the introduction of the Trudenta System, which we're really thrilled to be the only office here on Long Island currently using it. It is being used by over 400 offices throughout the United States, very successfully, mind you, but we're the first office here on Long Island to introduce it. And the most important part of it is the diagnostics. For the first time in my career, and I've been doing this 40 years, we are now able to literally utilize the wonders of the computer, as I'm doing right now, and go ahead and find out what the problem really is. Can we help you? Now, we don't want to waste your time or ours if there are things that we can't treat. So we have specific criteria that we go by, and the computer, these diagnostic tools show us what we can and cannot do, who we can treat and who we can treat successfully. Now, the second part of this requires treatment. Now, once again, in the past, it was either medication, splints, or a combination of the two, or possibly one type of surgery or another. Even the introduction to try to help people get rid of their headaches. Well, we don't believe in that. Our approach is totally non-invasive. Our approach does not require long-term medication or long-term dental splints. We believe that there are other ways to do this. And what we have done, and the Trudenta System, right now for over 6 years, has utilized some of the tools and some of the methodologies used in sports medicine and sports rehab and rehabilitation medicine, because we're dealing with similar issues. We're dealing with muscles, we're dealing with nerves, we're dealing with joints. No different than the sports rehab people deal with knees and elbows and wrists, things of that nature. Same thing as rehabilitation medicine. We all deal with nerves, muscles, and joints. So why not utilize those tools that have been shown to be effective for lots and lots of years and other modalities and other areas, and just bring them into the head and neck arena? Well, that's what we've done. So we now have such tools as ultrasound, we utilize microcurrent therapy, and we use something called a cold laser. Now, all of these are pain-free, they're FDA approved, all of these are non-invasive, there are no needles, nothing. If you leave feeling better, you don't have to worry about that. There's no anesthetics have to be utilized. It's a wonderful, comfortable experience. Sometimes we find results immediately, sometimes it takes several weeks. There are certain parts you do at home. Now, that's real important because no long-term result can be achieved if you don't participate. So we will provide you with all the tools and all the tricks that you need to know at home to minimize these headaches, if not only in frequency, but in severity. So that if you find that you are having 10 headaches a month, hopefully we get you down to 2. If you find that your headaches on a scale of 0 to 10 were a 10, we hope to get you down to a 2 or a 3. And then we help you manage those long term without medication, surgery, etc. That's the whole purpose of the Trudenta System. We want you to start living your life again. That's what's important, so that you're not missing family events, you don't miss days at work, you don't feel that you have to lock yourself in a dark room during the day to stop the headaches from occurring. We can help you. Those of you that want help, we're here to help you. So please give us a call at 877-626-0979. Call is free. And we'd like to offer you initially, because this is brand new to the Long Island area, a complimentary consultation. Come in, sit, we'll talk, we'll find out if this is something that you think will help you, and if we think we can help you. It's a two-way street. If we agree, then we can start talking about the actual process. But the consultation is complimentary. You have nothing to lose. As I said, even the phone call is free. So give us a call. We're here in Garden City. We're right adjacent to the Roosevelt Field Mall, so it's easy to get to us on all the major highways. You can take the train from the city into Mineola, so you can get to us real easy. And we're here to help you achieve the kind of lifestyle you want to have and not miss all those great events with the kids, not have to sit home in the dark room during the day. So give us a call. Once again, my name is Dr. Cary Ganz. We're located here in Garden City, and the phone number is 877-626-0969. Got to make sure that's right. Yeah, 626-0979. Yeah, it's a new phone number. So give us a call. We're here to help, and we look forward to hearing from you soon.